Can bone cancer radiation therapy cause fractures? Have you ever wondered if radiation therapy for bone cancer can lead to fractures? The short answer is yes, it can. Radiation therapy is a common treatment for bone cancer and bone metastases, but it can also weaken the bones in the process. This happens through various mechanisms that affect bone structure and health. When radiation therapy is applied, high-energy beams target cancer cells. However, these beams can also damage normal bone tissue in the treatment area. One of the main ways this occurs is through direct injury to bone cells. Radiation can harm osteoblasts, which are the cells responsible for building new bone, and osteoclasts, which break down old bone. This disruption leads to a decrease in bone formation and an increase in bone breakdown, ultimately weakening the bone matrix. Another significant factor is vascular damage. Radiation can impair the blood vessels that supply the bones, reducing blood flow and oxygen delivery. This further compromises bone health, making bones more susceptible to fractures. The risk of fractures is particularly concerning in weight-bearing bones, such as the femur and spine. Studies show that fracture rates can vary widely among patients but can be as high as 6 to 7% or more in certain groups undergoing radiation therapy for tumors near or within bones. For instance, patients treated with intensity-modulated radiation therapy for soft tissue sarcomas near the femur have shown a cumulative fracture risk around 6.7%. Additionally, postmenopausal women who receive pelvic radiation may experience elevated risks of hip fractures even years after their treatment. Fractures resulting from radiation therapy are often considered late complications. They can significantly impact a patient's quality of life, leading to pain, loss of mobility, and even increased mortality risk. The likelihood of experiencing a fracture depends on several factors, including the radiation dose, the fractionation schedule, the specific bone involved, and individual characteristics such as age and overall bone health. Some treatment approaches, like single-fraction radiotherapy, have been studied for their potential to reduce fracture risk while still managing pain. However, the risk of fractures remains a concern that healthcare providers take seriously. They monitor and manage bone health to minimize this risk during and after radiation therapy. In summary, while radiation therapy is a vital tool in treating bone cancer, it can indeed lead to fractures by weakening bone through cellular and vascular damage. It is essential for patients to discuss their individual risks and preventive strategies with their oncology team to ensure the best possible outcomes.